registered physiotherapist. Today I'd like to talk to you about the relationship between SI joint pain and weak inner core or weak pelvic floor. So essentially your SI joint or your sacroiliac joint, that's essentially where your the side of your pelvis here and your sacrum, which is basically the lowest portion of your back, it's where that meets. And essentially when a patient comes in with pain in this area, a lot of times in terms of how they'll present, it'll be a very specific point that they'll point to in terms of where the location of their pain. So they'll say, my pain is right here. And it'll typically be, again, right on that SI joint area. Typically it won't refer down. There definitely won't be any numbness or tingling. It won't involve sort of the lumbar spine at all, or it typically won't have pain, again, on both sides. So it'll be a very specific location, and typically patients will complain a lot of times, particularly if the pelvic floor is involved, with pain with transitional movements and with plant and twist and rotational movements in particular. So what ends up happening is the SI joint, just like any joint, it's got some movement in through that area. And what can essentially happen is, due to hypermobility of that particular region, which basically means that there's more movement than the norm per se. So a lot of times this is just systemic, and what I mean by that is certain individuals, they just have hypermobility in all their joints, so they'll tend to move a little bit further than the norm, whether it's their wrist, their elbow, right, their knee. You also actually, in terms of SI joint issues, you see this a lot in pregnant women. And the reason for that is with these different hormonal changes that occur during pregnancy, basically the joints become essentially more mobile, right? And so when I see this particular condition, a lot of times what we need to look at as well is, well, what's going on with regards to their underlying core strength, and again, in particular, the pelvic floor region. So the pelvic floor, essentially what it's responsible for is actually stabilizing, right, the pelvis. And so when it's weak, what can end up happening is, again, you can get some more movement and torsion in through the SI joint. There's actually ligaments that attach, and ligaments, they attach bone to bone, that attach onto the SI joint. They can become overstretched, they can become inflamed, and you can get what's referred to as an SI joint dysfunction, in which, due to this increase again in movement and torsion, there's pain. And so one of the ways that we want to essentially treat this is by strengthening the inner core muscle and the pelvic floor. And this will involve all sorts of different exercises. Perhaps you've heard of what's referred to as the Kegel technique. So these particular strengthening exercises really help to develop, right, that inner core and pelvic floor strength in order to, again, stabilize the SI joint. For some individuals, depending on if they're quite active or the degree and the irritability of the pain in the SI joint, there's actually a belt that can be recommended. I tend to, in terms of belts and things of that nature, I look at it as a short-term crutch, essentially, just to help with that sort of acute pain. And basically what the belt does is it goes typically below the waist, right? So it's right along that pelvic area, and it helps to stabilize the pelvis and essentially do the job of this the pelvic floor muscles. And so again, from just a temporary standpoint, they also make these specific for again, women who are pregnant. It's a nice way to help with the pain on a short-term basis while an individual is working on strengthening, right, those different muscles. And then, as I mentioned, good idea to then wean off of the belt so that you're not relying on that. And in fact, what can sometimes happen is, as a result of reliance on the SI joint belt, those muscles then, they don't have to work as much, they get weaker and weaker and weaker, and actually it creates a bit of a vicious cycle where it might in the end actually become more irritable as a result. So that's in terms of my preference. Again, it would be to strengthen as much as possible those particular regions and then wean off the belt. Thanks again for watching. If you have any questions, concerns, comments, please feel free to leave a comment below. And also make sure to check with your physiotherapist or doctor if this is an appropriate intervention or exercise for you. Thanks again. Take care.